Okay, today's the 17th of September, and we're here with Stefan, who is here because he injured his knee. He took a long hike in the Alps over the summer, which was phenomenal, and stretched his physical endurance to the limit, but didn't damage his knee. Then last week, he was doing yoga, and he felt a searing pop in his knee, and you've been in pain and you've had swelling since. Is that correct?
That is correct.
And we want to look at the knee here. Can you roll up both sides? For the viewer, put them together. The viewer can see obviously that there's a problem on his left knee. And straighten your legs to the extent that you can, please. And here you can see the extent of straightening, and you can also see the extent of swelling in the left knee as compared to the right. And if I put my hand right here, there's a lot of swelling, and he has a significant amount of pain right in this area. So you're my first case of an acute cartilage injury. This is probably a medial meniscus, and that's why I asked you for permission to video it, and we're going to go ahead and do your treatment. And I don't expect immediate results with an acute injury like this, but I hopefully expect to see faster healing, significantly faster healing than we would otherwise. You okay with that?
Yes.
Okay. I also asked you to walk. Go to the door, please. This is before treatment.
Okay.
Okay, come on back. Whoa. And that's because of pain, correct?
Yes, absolutely.
Okay, that's because of pain. Do you also feel instability with that, or just pain?
Instability, yeah, because of not trusting my left leg now.
Understood. Okay.
Amazing.
This is just after his treatment, a couple
Yeah.
minutes later. He's got a smile on his face. Walk to the door.
He only looks 80 instead of 90.
Wow, that's
Right.
amazing.
All right.
Yay.
Both of you are happy. You're very impressed too,
I
aren't you?
am, because I've had it before myself.
Okay.
And I love it.
Now, my intention ultimately is to put this on YouTube. Do I have your permission?
Yes, you do.
Yes.
And your permission as well. Okay.
Yes.
Now, I want the viewer to know, I'm explaining this to you now. You are my first acute injury of a cartilage. I didn't know what to expect, except that my goal is to get ozone and oxygen into your knee to help it heal faster.
Right.
And right now, you're feeling much better. You're walking around much better with a big relief. We don't know how that's going to be later today or tomorrow. We're just taking it one day at a time.
Right.
I believe this is a good sign. My belief, having done ozone since 1986, is it speeds recovery, it speeds healing. Getting oxygen into tissues that's what tissues need to heal. You understand that, right?
Yes.
And when you injure something, you disrupt circulation, and in the case of your knee, you have swelling and effusion in your knee, and that slows down oxygen diffusion because oxygen has to come from the joint capsule to the cartilage. Make sense? So we might be able to just get right in there and abort the inflammation in your knee by getting the tissues to repair very quickly, getting that oxygen in. That's the goal, so we'll see how this goes. Okay,
Okay.
thank you. September 19th, we're back with Stefan about 2 days after I first injected his knee for an acute injury. And by acute, most likely an acute meniscus tear. And do you want to give us a report on how you've done since I did Prolozone on your knee?
After the initial injection, there was much relief as far as the pain. There was a little swelling, but overnight that went down, and I was amazed when I got out of bed that the mobility was greatly increased, and I could actually lift my leg without using my arms, and I could, when I stood, put a little pressure on it without any pain. which I would say is a tremendous amount of improvement over I would say a 16 to 18 hour period from the injection.
You were in agony when I first saw you.
I was in agony. I was hurting.
All right, we haven't, this is 2 days later. I haven't done anything yet with you today. So I'm going to step back and I'd like to see you walk to the door, please.
Okay. I am hobbling, but virtually no pain. There is a little stiffness in the knee, not being able to bend it. But
I'd expect it to be stiff. There was an infusion in there. There was fluid in there
Right.
the other day. So you're walking to that door far, far better
oh yes, I am.
than when I first saw you 2 days ago.
Yeah, this is an improvement from yesterday. So
It's an improvement from yesterday, right? And you walked into the office and you didn't even use your crutch today.
correct.
And I think you needed crutches to do anything 2 days ago.
Oh, absolutely. Yeah.
Okay. This is important for me. I have your permission to post this on YouTube, correct?
You do.
Thank you. This is important for me because most of what I see with knees is chronic degenerative conditions. We get generally really astounding results. I would have expected to get good results with acute injuries because we're getting oxygen in there, but I've never done it, so I couldn't tell you from
Right.
firsthand experience.
Yeah.
And I'm honest with my patients.
Yeah.
So now we're seeing
appreciate that.
the incredible benefit here.
It's pretty amazing. It's pretty amazing, especially when you're the subject.
Yeah, thank you.
You're welcome.
One additional thing, I just decided to show the difference in the knees. That's his normal right knee. That's his injured left knee, and you can see swelling. But it's significantly better. And Stefan told me that when I went like this to it the other day, it hurt like hell, didn't it?
Yes.
And it's very significantly better today when I do it.
Yeah, it's a perfect.
And he also didn't know it until yesterday, but he injured his ankle too, probably. We can look right here and see a nice scalloped area where the ligament would come from the medial malleolus to the foot bones, and you don't see that over here. And when I press it, it's tender.
Yeah.
So you've asked me to treat that as well, yes?
Yes, because it's probably the result of the injury, and I had such success from the knee injection that I definitely want that to heal fast too.
I will tell you, I have had experience with acute ankle sprains with Prolozone, and the results generally are really quite good.
Good.
I'm just really happy now that I've had a chance to experience an acute knee injury.
Well, I'm glad to.
I mean, not
oblige
that
in
it's
a
you,
way.
not
I
that
know.
it's you, not that
know.
it's you, but to satisfy myself as to the efficacy of this.
Yeah.
Thanks.
You're welcome.
We didn't get on the video on the day one was your range of motion. Can you straighten your left leg for me, please? You can get it almost straight. Now bend it for me as far as you can. I've got to tell you, that's a miracle to me.
Yeah.
Because you were in agony, and I couldn't even get it 2/3 of that the other,
Right.
right? And now you're doing it flawlessly. Okay.
And the only thing that's preventing it is the stiffness in back.
Right, and part of that is the fact that there is swelling in there. You injured your knee, and there's a fusion, and that's going to limit your movement.
Right.
And it's also there to limit your movement because you injured it. So
It's a protection.
it's a protection. When we injure ourselves, there's inflammation, there's swelling, and that's one mechanism by which we reduce the use of that to limit further injury until the body can heal to the extent it can heal.
To overcome our stupidity.
Yeah. Hey, Stefan, we've just done treatment number 2. I'd like to see you walk to the door. And smile on your face. You can sit down.
Okay.
Over on the chair here, please.
Okay.
And please tell me, please tell the viewer any comments you might have on the treatment.
Well, basically I was amazed at the results. And the treatment itself, I had some trepidation at first. Sticking needles in my knee didn't actually appeal to me much, but once it was done, I was amazed that it wasn't really that bad. For a short amount of time there was some discomfort, but the results so greatly outweighed that slight little bit of discomfort that I'd say go for it.
How does, we did your ankle too. How does your
Yeah.
ankle feel right now?
Wow. No pain. I mean, this is a matter of how many minutes? Whoa.
Like 1 minute?
Yeah. Yeah.
Okay. So
Amazing.
if you press down on it, no pain.
No. It was just that one spot. And
Yeah, I
it's-
know, it was one spot. You sprained the anterior part of your deltoid ligament,
Yeah.
right off of where it originates from on the anterior part of your medial malleolus,
Okay, whatever
which
you
is,
say.
yeah, which is the end of the tibia.
Okay.
All right, that's
All right.
that's the main lower leg bone.
Yeah.
And it's a common injury for ankles, and I'm pleased that we might be able to speed this up for you as well.
Yeah, thank you.
Okay, thanks. I'll want to see you back next week if we can.
Yes.
Good. I thought of one other thing, Stefan. When you came in, you told me you had been placing cold packs on your knee because of really bad swelling and discomfort.
Right.
And you were doing that pretty much right up till the time you saw me.
Correct.
Have you needed any since?
No, I have not.
Okay. Does it also make sense to you, perhaps, that the use of cold packs might be contraindicated because it would reduce circulation?
Yeah. Once that was explained to me, I realized that it's going to slow down circulation, and circulation is what promotes healing, so it seems contradictory.
Yeah.
Yeah.
Oxygen is really the thing that's going to promote healing the most.
Right.
And your knee got a free dose of oxygen with the ozone injection.
Right.
Good.